some stuff that everybody's, well, not everybody, but a lot of guys are dealing with. And this is a topic that I think that, you know, if you're blessed to get older, you're going to run into these problems. So you're going to want to listen. You're definitely going to want to listen to this talk, because this talk is going to be for you. Now, I'm Dr. Melvin Fussell. I'm a board certified urologist. I'm also the founder of UroHard for Men. All right, where we can make you bigger, longer, harder. Bigger is increasing girth, longer is increasing length, harder is erectile dysfunction. Now, because I'm a urologist for over 20 years, I cover all those bases. All right, I have my own private operating room. People are flying in from all over the country to see us. And I really, really appreciate that. I find it very humbling that people are coming from California, Texas, New York, Miami, Mississippi, North Carolina, South Carolina. Now, I can tell you that list goes on, because we're also getting guys internationally. We got guys flying in from Uganda, different parts of Africa, just coming right here. And that is truly a blessing. Now, this conversation is strictly for educational purposes. Why do I say that? Because I ain't your doctor. All right. At this point, I'm just a doctor over here talking, so I got to say stuff like that, medical, legal stuff like that, because the thing is that I can educate you on the subject, but you still got to go to your doctor and sit down in front of your doctor, because they know all your history and physical exam and your medications and stuff like that. Now, during this talk, all right, if you want to ask questions, chime in, put it in the chat. And that helps us out, because that usually your question is something somebody else wanted to know anyway. All right. Now, what are we talking about today? Oh, and my nurses always reminded me that if you're just joining, realize that we're trying to destigmatize male enhancement. And I'm asking you to like and share our lives so other people can actually pick up on these talks and stuff like that. Some of them have really been hidden. I mean, we started out, we just did 200 people, and then we got up to 400. Then we've been over like 2,000. So I'm really thankful for that. These are medical talks, but I'm hitting on real life situations. Why? Because I know what I'm talking about. So let's talk about let's get into what we're talking about today. It's going to be about bent, broken, or just not working. So let's talk about it. You know what I'm talking about. I'm talking about that. Is it bent? Do you have a crook in your banana? Or do you have like a bent pickle? Or is it just broken? Maybe it ain't working at all. That's what we're going to talk on. Now, all right, guys, let's be honest for a minute. If it's bent, not working, or just not hitting like it used to be, you need to understand you're not alone. This is something that so many guys are dealing with. So this is not like a thing where it's just you. What I'm trying to tell you is put questions in the comments. This is the time to ask a urologist. You can ask me directly. All right. So this is stuff that nobody talks about, but everybody deals with it. That's why we're having these conversations, because nobody wants to really talk about it, but everybody's dealing with it. So today we're talking about what really is going on down there. Yep, I'm talking about the penis. We're talking about down there. Is your penis bent? Is it broken? Or is it just not working? All right. So do me a favor, drop a fire in the chat if you wonder if something's been a little bit off, because that's what we're kind of talking about today, where things are not what they used to be, or I got a problem. Now, just to kind of get everybody involved, I kind of like doing this thing of would you rather. So, would you rather, here we go, be perfectly straight but can't keep it up, or curved but strong? All right. Put it in the chat. Would you rather be perfectly straight but can't keep it up, or curved but strong? Which one would you rather be if you had to choose? I, you know, I can tell you, if you're perfectly straight, but you can't keep it up, what good is it? But some guys can work that curve. I get that all the time. Some guys can work that curve, and we're going to talk about that curve. All right. Because is it just a curve that I've had for years and it's natural and it's stable? Or is it a curve that's getting worse? No, that's a problem. And we're going to touch on that. Did anybody put anything in the chat?
Curve was strong, unanimously.
All right, great. Here we go. Would you rather, here's another one, be bigger but unreliable? You got a big sausage, but you ain't reliable. Or smaller but dependable. You already know. All right. So the thing about it is that would you rather have a big pickle, but the pickle ain't reliable, or would you rather have one smaller, but it's dependable, always standing to attention? I already know what you're going to say. You want to be reliable. But I can tell you, if you're already reliable, I can make you bigger. That's what I do. All right. Now, y'all joking, but this is real life for a lot of men. I know I kind of say this kind of stuff because I want to make kind of light of it. I need to loosen people up because we're talking about subjects that most people don't talk about. So we kind of gotta loosen it. And then I have to walk the line where if I say too much, then they're gonna try to censor what I'm saying. But understand this: these are strictly educational medical talks. And also, please share us so we can kind of get out there because what we're trying to do is destigmatize all this stuff about male enhancement. And if you got a question, throw your question out there.
First question: can you get procedure and still keep your curve? This guy says his wife likes it.
Yes, that is a great question. The question is, can you have the procedure done and still keep your curve? Yes, you can. Yes, you can. What we're going to do is make you a bigger version of you. And guys always ask that about, male enhancement, stuff like that, because with our procedure at UroHard for Men, when we talk about bigger, longer, harder, what he's asking about is being bigger. Can I make you bigger and then you can still keep your curve? The answer is yes. Yes, we can make you bigger. We can make you bigger, no surgery, no cutting, it's painless. Go home same day, back at work the next day, and it's permanent for life. Now, there are a lot of other procedures out there where other doctors are doing stuff, but the difference that with us is that it's permanent for life. The difference with me is that I'm a male genitalia specialist. I'm a surgeon for the penis. So, if you're going to get it done right. You might as well come see me. All right. Now, ooh, the lights in my eyes are like, ooh, blinding me. All right. I don't know if we can turn those lights down a little bit, but when I look up at the lights and I look back down, man, I can't even see my paper because the lights are blinding me. All right. So now let's talk about this whole thing about having a bend. All right. Having a bend in your penis. Now, first of all, how common is it? Well, actually, what we get reported is probably around about 6 to 9%, 6 to 9%. But what really happens is a lot of guys never report it to their doctors. So we know the incident of the bend is much higher than that. It's just only maybe less than 10% of the guys that complain about it, but actually maybe 10 to almost 15% of the guys actually have a bend. Now, just like one of the guys put in the chat, about, his wife likes it. Well, the bend can work in your favor. When you start talking about the vagina and where's the G spot and all this other kind of stuff, if you got that bend going up, maybe you can hit that spot, or whatever, or that bend going to the side. Remember, all the nerves are located in the walls of the vagina. So your significant other may actually like your bend. That's fine. If you like it, use it to your advantage. All right. But The thing about it is that when is the bend not normal? Because you can have a bend and it's really normal, but when is it not normal? Here's some points. If you notice that your curve is increasing, that it's bent and it's increasing and it's increasing, that, hey, it's bent more now than it was before. If that is the case, this is not normal. And you're going to need to talk to your urologist about it. All right. Remember, this is educational talk, but you need to go actually talk to your urologist. All right. Because if your bend is progressing, then that's not normal. All right. Maybe you've had this bend all your life. It's a minor bend. It doesn't bother you. It doesn't bother your wife, or your significant other. Then that's fine. Work it to your advantage. But if your bend is increasing and it's worse now than it was last month, then you realize you got a problem and that needs to be addressed. Is there a question in the chat? All right. So the thing is that basically that's when you realize your bend is not normal. Here's another point how you know that your bend is not normal. When you get pains on erection, you got a bend, but your erections are painful. All right. That's when you know that bend is not normal because it shouldn't hurt to have an erection. If you got pain with this bend, then you need to go see your urologist because what's happening here is that basically it's affecting the penis itself. Let me break this whole thing down. All right. What we're talking about here is Peyronie's disease. All right. Peyronie's disease. Now, you can look it up, read about it. It's Peyronie, Peyronie's. It's Peyronie's disease. You say, well, what is Peyronie's disease? Well, the penis itself has a sheath that goes around it called the tunica albuginea. All right. It curves around. Say if this mic is like a penis, it curves around it. All right. It's an outside sheath. But the problem becomes is that when the sheath gets injured, it doesn't heal like the rest of the skin. I always explain like this to my patients. Like if I had surgery and you cut the skin, I'm going to form a scar. All right. But eventually that scar is going to soften up. All right. Now I see where the scar was. I see where my surgery was, but it's not a hard scar. It's a soft scar after a couple of years have gone by. The problem with the penis is it stays hard. That scar stays hard. So when you actually try to get erection and the penis tries to stand up, then the scar pulls it in the direction of the scar. And now you got a bend. So you got a scar on this side if your penis bends that way. You got a scar on that side if your penis bends that way. Up or down, there's a scar. And usually we can palpate and feel that scar. All right. We call it a Peyronie's plaque. Now, the thing is that what happens in that case, you got to realize that the body makes collagen. Collagen is one of the building blocks of this. And that scar is mostly made of collagen. So it's a collagen type scar that's formed into the tunica albuginea. And because it's hard and it's tight, it won't let that penis stretch all the way out because it's pulling it to the side of the scar. That concave, convex type of thing. Yep. Got it. So, all right. So the thing is that that's what happens when we start talking about Peyronie's disease. Now, that information is important because we'll start talking about some treatment down the road, but understand this is a collagen buildup that causes a scar. And we also talked about if your erections are painful, and you got a bend and erection is painful, then you need to go see your urologist. Can something be done? Yes. There's treatment that can be done even on the early side, like injections of interferon alpha 2B, that can be injected to decrease your pain, things of that sort. And we'll talk more about that. Now, if you notice some shortening of your penis, that's also not normal. All right. Or you get some lumps and plaques, and that plaque is that hard area that form from the collagen. All those are not normal. So when you got a curve and you say, I like my curve, my wife likes your curve, you need to know, hey, is my curve just normal for me, or is this actually something that's not normal and is progressing? What we get concerned about is that if your curve is progressing. Let me know if there's questions in the chat. Guys, this is a good time to ask questions because usually information like this, you got to sit in front of a doctor and you're paying for their time.
I mean, there's questions that have been asked or answered in the chat. Someone
Okay.
asked, "What if I don't have any semen coming out?"
Okay. That's totally different, but we can touch on that.
Someone else asked, "What if I just can't maintain an erection?" Essentially.
Okay. All right. Great. Well, let's kind of talk about erectile dysfunction. We're going to talk about that. Is it broken? When we talk about erectile dysfunction, is it that you just can't get it up, or is it losing firmness, or it's just not lasting, or it's not as strong as before? See, that's the whole thing. When we talk about erectile dysfunction, it's a gamut over here. So it goes everything from I can't get erection at all, or I can get an erection that's not as firm. All right. Or that, I get one and it goes back down. So they're different. You got to make sure that your doctor understands what's really happening with erectile dysfunction. Now, I can tell you this, that when we start talking about erections, all right, and you guys have heard me talk about this before, there are three things that you need. You need good blood flow, good nerves, and desire. There's a fourth component that's psychological, but those three are the big things that you need. All right. So when blood comes in, it comes in through the middle and it goes out around the sides. There are circumferential veins out there that when it fills up, it compresses those circumferential veins and it traps. All right. Now they're compressed, and now you can hold blood in the penis. All right. That's that's when you got a good erection. All right. Now, the thing that goes around it, around those circumferential veins, is that's the tunica albuginea. That's that part out there, that sheath that we talked about, like this foam thing around here. So if you can imagine, the blood came in here and it filled up the mic till it got tight, and now the blood is actually trapped inside of the microphone. All right. I'm trying to paint a picture. All right. So that's what happens. Now, if a guy doesn't get a good blood flow coming in, his penis may get up, but then it kind of drifts back down because he's not blood trapping. All right. And that's where you start talking about things like a venous leak or something down that line, where it's just not trapping and holding the blood. All right. So you say, oh, it's not as firm. Usually when it's not as firm, you're also the guy that it drifts off. So you want that good firm erection, all right, which is usually blood flow coming in. All right, that's a blood flow issue. Or if you got a nerve problem where the nerves have been cut, then that becomes a whole nother issue. Or you got to be turned on to actually work this. That's the desire problem. That's your testosterone. All right. So when we start talking about that, the question becomes, are you losing firmness? Is it just not lasting? Is it not strong as before? uh and if it's not as reliable as it used to be, if all that's happening, then you realize that you're having some early signs of erectile dysfunction. Did you have a
Another question. If you've been on steroids a long time, will it shrink?
If you've been on steroids a long time, would it shrink? I don't have a direct answer for that. That's something I need to look up because I don't want to BS you. But I can tell you, you got to look at why were you on steroids? Are there other factors that are going on that could have led to the shrinkage? How much have you been using it? That could lead to shrinkage. Before you say it was the steroids. So I can't just say it's the steroids. You got to look at all the other factors. So I'm just trying to be transparent about, I'm not really sure if steroids are really a cause of shrinkage. I don't think so, but that's something I would have to look up. Let me get back to you on that one. All right. If there's another question, let me know. So, so the thing is that what we talked about was we were talking about Peyronie's, where you got a bend in your penis, and we also talked about erectile dysfunction. Now, these problems are real and they can cause a real impact. It can impact your confidence, where you're at a point where, hey, I'm just avoiding intimacy. All right. Or it can put a strain on your relationship. You know, men will avoid the situation before they admit there's a problem. So, guys, if you're noticing that, hey, my erections are not what they used to be, or this bend in my penis is causing a problem, the best thing to do is do something about it. Be honest with yourself. All right. And know that there's a problem. And if you got a significant other that has this problem, you need to bring it to his attention that, hey, something can be done to fix this. All right. Now, the myth is that most people have out there is that it's just going to fix itself. No, it's not going to auto correct. All right. That's not true. If you got a bend and the bend has been there, the bend is not going anywhere. If the bend is progressively getting worse, it's not going to progressively straighten out. All right. And you can't just think that, hey, this is just aging. I'm getting older. All right. Nope. Something is going on. All right. And then the other thing is that people think that, hey, nothing works. Well, that's not true. There are things out there that can be done to fix your bend. There are things out there that can be done to improve your erections. All right. So let's talk about some treatment. All right. When we start talking about treatment of a bend, basically, you know, the the thing that is FDA approved is called Xiaflex. All right, it's a collagenase where you go actually inject it directly into the scar. All right, that collagen buildup, and the collagenase breaks it down. All right, and supposedly lets it straighten back out. What's the downside of Xiaflex? It doesn't happen often, but it can cause a corporal eruption. All right, well, basically it dissolved it to the point the corpora popped through. All right. So that's the problem. What can happen with that? Another thing is that, that's out there is verapamil. All right. They can inject verapamil into the scar. It doesn't work as well as the other thing as a Xiaflex, and it doesn't work as well as interferon alpha 2b, which is another one that's out there. So there are things that can be injected actually into the scar to try to break the scar down. All right. So the collagenase is Xiaflex. That's the one that's FDA approved that they get the highest level of response from, but it has its problems. And the thing is that it doesn't always work. It's as simple as that. It doesn't always work. All right. Now, I have a tendency because I'm a surgeon to do a surgical fix. You say, oh, doc, you're going to cut on me? Yeah, but what I do is very simple. All right. We're talking about basically numbing up your penis where you don't feel what I'm doing. I'll make a slight incision right over where the scar area is. And then I will throw some stitches and just straighten it back out. You get off the table with a small bandage, you can go out to dinner. I've actually had guys fly in, see me. I straighten their penis out. We go out to dinner. It's a simple procedure. So, yes, you can have it straightened out. You get it straight, and I can tell you the next day is straight. With all these other treatments, you got to go several times for weeks on end for injections, hoping that it's going to be straightened out. Or you can come and see me, and I'll straighten it out 30, 45 minutes. Boom. It's done. It's straight. You're back to being an arrow. Now, the thing is that when we look at treatment about that, we're always going to want to know how long has that been there? Is it a progressive bend? Because then I'm going to want to wait 6 to 12 months to say, okay, I shouldn't do anything. Or if you're the early form of the bend, then maybe you should consider like an injection or something like that to try to stop that scarring that's happening. That would be wise if you caught it early. So if you notice you got a bend in your penis and it's progressively getting worse, go ahead on and go to your urologist. Maybe they can do injections of verapamil or interferon alpha 2b, or maybe Xiaflex to try to stop it from bending so much and slow down the process. But if you do nothing and now the bend has been there for several years and it's a stable bend, I got a hook It's been there for several years. I want to straighten out. Okay, come and see me. Give me a few minutes. Give me 30, 45 minutes, and I'm going to straighten it back out. All right. So now you're straight. Did I say that straight enough for you to understand? It's straight. All right. So now, thing is that we talked about treatment for Peyronie's. Let's talk about treatment for erectile dysfunction. Here's a big overview. I always say, think about it like swinging a pendulum. All right. So, your early forms of erectile dysfunction, that's where you take the pills, the Viagra, the Cialis, the Blue Chews, and all this other kind of stuff. There's tons of stuff out there on the market that they're throwing at you and all this other kind of stuff like that. That's in the early stages. All right. Now, other things that you can do is you can use a vacuum pump where you're actually cycling that tissue, and I recommend vacuum pumps are very good. Very, very good. Because what they're doing is they're pulling blood flow into the tissue. Actually, if you got an early bend in your penis, you can use a vacuum pump to try to keep it as straight as possible. So using a vacuum pump is a good thing. Don't sleep on the vacuum pumps. It's very good. For my older patients, I tell them, hey, if you don't use it, lose it. You're going to lose it. If you don't have a significant other, then use a vacuum pump. But you got to keep that tissue active. All right. So vacuum pumps are good for you. Straighten it out, pull blood flow in there, make that penis do some work. All right. It's just like putting your arm in a cast. And I kept it in a cast for 5 years. I never straightened it out. The arm is going to atrophy down. It's going to be a small arm. It's not going to be like the other arm. But now I got to go through physical therapy to straighten it back out. Think about your pump as physical therapy for your penis. All right. The pendulum keeps swinging across. So now I'm thinking about doing stuff like injection therapy. There's the bimix, the trimix, the quad mix, where I can actually inject medications directly into the penis and give you a chemical erection. Now you went from I can't get erection to I got an erection that lasts 1 to 2 hours, but it's a chemical erection. Fine, you can use it. Same sensation. Thing is that the penis goes back down when the medicine wears off. You can fall asleep. You got a tent in the sheets. It's not going anywhere until it wears off. Now, the problem becomes if you develop priapism. So you need to be tested to make sure that the medication is too strong. I know personally that my formula, because every doctor has their own formula, my formula is on the strong side. Why? Because I'm dealing with worst case scenarios. I'm dealing with the guys that nobody else could help out. So these guys are coming from all over the country saying, save me, save me, save me. So, I ain't messing around. My formula is very strong. So, yes, we do have to test you and make sure it's not too strong. And we have to make adjustments and things like that. But the whole objective is to get you back in the game. All right. So that would be called injection therapy. Now, the thing is that all those are medications. You say, well, can I just fix it? Yeah, sometimes you can fix it. And that's where you get into other things like PRP, things of that sort, and say, can I fix the tissue and get it back to working? You know, things of, down the line of some supplements and all this other kind of stuff. But it's a combination of all that. That's what we do here. We work it from every direction before you get to the final choice, which is a one-way street. And that is having a penile implant, IPP, inflatable penile prosthesis. That's where you actually go in there and you have surgery, and we actually put the prosthesis directly in there inside the penis. Now, when we do that, that actually destroys the corporal tissue of the penis. Now you can't get erections like you used to because we actually put a device right through the vasculature. All right. So it's a one-way street. When you have a penile prosthesis placed, that's you for life. You will always be dependent on the penile prosthesis. Now, the thing is that what's nice about it is that once it's there and it works, it's mechanical. You can pump it up, and that thing is going to stay hard till you let it back down. You can go all night. Don't matter until you let it back down. The downside is that you're going to lose length and you're going to lose girth. All right. And hopefully your doctors are discussing that with you because you will lose size with a penile prosthesis. And if you're considering one, you need to ask, Will I lose size? And they should tell you, yes, you're going to lose size. You say, well, why? Why am I going to lose size? Because you got to make sure the device is not oversized where it will protrude through the skin. All right. That's an erosion. All right. So we can't oversize the device. All right. So you got to put one in there that doesn't oversize device. And yes, you can lose size. But is there hope for the guy who lost size? Yes, there is. That's where you come and see me. And I can increase your girth. I can get your size back. All right. So that's where we basically can use our filler procedure and increase the size of your penis back to the size that it was or even bigger. All right. So the thing is that if you've had a penile prosthesis placed and you know that you lost size and you want to get your size back, give us a call. We can do that. We do it all the time. Guys come from all over the country and we help them get their size back or we make them even bigger. So there's an upside to that. After you've seen me, you got this big penis that will stay hard as long as you want it to. That's what I call a weapon. So yeah, come and see me if you had a penile prosthesis and you're not happy with your new size. We can do something about that. Now, basically, I'm looking for guys to ask questions. Are there any questions out there?
How do you lengthen it?
How do you lengthen the penis? All right. Now, the thing is that there are several different things you can do to lengthen the penis, but a suspensory ligament release is the main thing. Now, understand this. When we start talking about the length of the penis, what you see is what's hanging out of the body. Let me just give you an example. You might have 6 inches hanging out. All right. But the penis goes into the body and curves up to the bladder. So there might be another 4 inches on the inside that's going up to the bladder. So realistically, your penis is 10 inches long, but you only got 6 inches that hangs out the body. Because we can only see what's hanging out the body, we say, I got a 6-inch penis. Oh no, the rest of it goes inside the body. Now, the suspensory ligament is what holds it at the top. So if you feel right here, there's a pubis bone, and right below that, there's a ligament. All right. And if you're a thin guy, you can actually feel that ligament. Pull your penis down and kind of rub right over, right under that bone. You'll feel the ligament. All right. Now, if we release that ligament, now more penis can hang out. All right. So visually, we've helped your penis hang out further. So now you got more penis hanging out. That's a lengthening procedure. All right. If any other questions, let me know because we're getting to the end of my talk here. Because basically, what I'm doing here is I'm talking about Peyronie's disease and erectile dysfunction. This is strictly educational talk. Why? Because I'm not your urologist. I'm a urologist that you're seeing on social media. And because what we're trying to do is destigmatize all this stuff about male enhancement, please like and share.
So, State Frosty is the person who asked about the steroids. He says he's been on testosterone replacement for 20 years. He also had a vasectomy with a reversal.
Okay.
So I guess he's talking about, does testosterone make your penis shrink?
Not necessarily so, about the testosterone, things of that sort. Remember, you need 3 things to get a good erection. You got to have good blood flow, good nerves, and desire. Testosterone is going to help you out with desire. Now, what testosterone does cause to shrink are your testicles. Your testicles will become smaller over time after you've been on TRT. That's testosterone replacement therapy. After you've been on testosterone replacement therapy, you interrupt the feedback loop. All right. And the way the feedback loop works is basically, the anterior pituitary gland in the brain releases LH and FSH. They go down to the testicle and it tells the Sertoli cells and the Leydig cells to make more. All right. The Sertoli cells are making sperm, the Leydig cells are making testosterone, and that testosterone can be sensed. So then the curve comes back around and says, hey, brain, I got plenty of testosterone. You don't have to keep telling us to make more. Now, it's a loop. It's a feedback loop. Now, what if I give you exogenous testosterone from the outside. All right. Well, I give you a shot and now your brain is seeing all this testosterone. Well, I don't need to release LH and FSH because I see that there's plenty on board. So if I'm not releasing LH and FSH, then the testicles are not getting a signal to make more. So what happens to the testicle? They're like, man, I ain't got to do nothing. So it starts to shrink down and you will actually lose testicular size. All right. You actually can shut down the feedback loop and now your testicle is much smaller over time because you've been giving yourself outside or exogenous testosterone. So you threw out the loop. Now, can that be reversed? Yeah, it can be reversed. It takes a lot to actually wake back up the LH and FSH and get things back going again. There are other things that can be done. That's a whole medical protocol that goes over maybe like 12 weeks of treatment to get your hormonal system back working and hopefully get those testicles to actually start back putting out testosterone. So yes, are there shrinkage when we see your own testosterone? Mostly in the testicles. Your nuts will get smaller. All right. Just went off on a tangent on that one. But the guy asked, and I'm telling you, you should ask your questions. All right. So
Here's another one. After the ligament release, will it give you a longer erection?
actually, the question is, after the ligament release, will it give you a longer erection? Now, if you go look at the literature, it says that your erection basically is the same. It did not get longer. All right. Now, it's kind of counterintuitive, and there are some that believe that, some that don't. But according to the the literature, all right, if you go read the scientific papers, your erection is not longer after ligament release. That's what it says. That's what we're taught in urology. Now, I haven't done ligament releases and going in there and, measuring everybody's erection to see, but those tests have been done. Those papers are out there. There's your answer. All right. But will it hang longer? Yeah, it's going to hang longer. It's going to get more swing. But I can tell you this, when you do our filler procedure, when we make your penis bigger and we're increasing your girth is where it's at because you're actually, if you're talking about sex with the female, it's going to fill up the walls of the vagina. So she's going to actually enjoy it more because the sensory is there. All right. But here's the other side of that. This penis now is bigger, it's heavier, and it will hang longer just from the mass effect. You got more mass down there now. So now it's actually hanging longer. So we don't push our filler procedure as a lengthening procedure, but do you gain length? Yes, you do. Why do you gain length? Because it's physically just a bigger penis. It's going to hang longer. All right? You're swinging. That's where you go from a grower to a shower. Now I'm a grower and a shower. So I really like the filler procedure because I always tell my guys, yes, we can do the ligament release for you, but you're going to pick up size and you're going to pick up some length just with the filler procedure, even though we tell you that we're really focusing on girth. All right.
Thank you.
Oh, you're certainly welcome. Hopefully I hit that one out the park for you there, buddy. All right. Now, if you're not asking questions, I'm getting to the end of my talk. This is where I just answer questions, because basically, there are ways to improve all these problems. There are ways to improve your function. There are ways to improve your shape. And yes, we can increase your size too. That's what we do here at UroHard for Men, because we can make you bigger, we can make you longer, we can make you harder. So we handle all aspects across the spectrum. You got to just decide, what do you need us for, and pick up the phone and give us a call. Go to our website, which is urohard.com. That's HARD.com. All right. And when you go to our website, we actually have what we call that little thing?
AI assistant.
We have an AI assistant that can actually talk to you. All right. It's just like a little chat box, but it will talk to you verbally, or you can put it into where it's just going to print it out. Say if you're like somewhere where you don't want everybody to know that you're on my website, how some people be tripping. All right. You can actually go on there and just type questions in and it'll hit you back type, or it can actually talk to you. You can put your phone into speaker mode and just speak to it, and it's going to talk to you back and forth and ask questions. So go talk to my website. Better yet, talk to me. Talk to my office. Give us a call. Our phone number is 478-225-9324. That's 478-225-9324. Call us. We can answer your questions.
Does having ED and being overweight cause shrinkage?
That's a question. Does having ED and being overweight cause shrinkage? Now, there's a lot going on there. All right. First of all, if you're overweight and you got a big suprapubic fat pad, you say, well, where is that? That's the part where the genital hair covers it up. That's your suprapubic fat pad. Now, as you're gaining weight, that part can get bigger and bigger. Some people call it a fupa or something like that. Well, think of it like this. If this is the penis and it's getting fatter, it's getting fatter, it's getting fatter, and now this is all I got hanging out, I can actually go in there, push that fat back, and the penis pops out. But when I release the fat, it goes like that. Because your fupa or your suprapubic fat pad has gotten so much bigger that the penis is actually turtle shelling back in there. Now, if you're not using it, yes, your penis is going to get shorter. If you got a big fat pad, yes, your penis is going to look shorter. All right. So you got a lot working against you there. But can we do something about it? Yeah, we can do something about it. First of all, we can liposuction the fupa and get liposuction that and remove a lot of that fat in that area. All right. We can also do a ligament release and help it go out further. We can work on your erections and help you improve your erections. We can also make it bigger. All right. So yeah, things can be done for you. Hey, don't sleep on that. Give us a call. 478-225-9324. Let's talk about it. What was the other question, Lisa?
So Casa Mike just said, "Wow, really?"
Thank you, Casa Mike. I appreciate it. All right. So now, guys, this was your chance. I'm getting ready to wrap up our talk. Usually these talks are done on Thursdays. This week we had to move it to a Wednesday. I appreciate you coming in to listen to us and understand that these talks are for educational purposes only. All right. Why? Because I'm not your urologist. I'm not your doctor unless you come and see me. All right. So you can't say, oh, Dr. Fussell said on social media, you know, I'm giving you truth though. You can also go look it up, fact check me, go ask your urologist. Why? Because I know what I'm talking about. I've been doing this for decades. Now, thing is that understand this. If you want to change the game, you want to change your size, all you got to do is make a decision. Pick up the phone, give us a call. Let us help you out. Let us change the game for you. This is real. When I tell you horns up, that's what we do. We raise them up, and everybody wants a bigger horn. Wrap me up.